When it comes to spondylolisthesis, we have a perhaps slightly different take on what imaging is best. And I will explain why, because this is based on clinical experience rather than any particular research that I could talk about, as well as common sense. Fundamentally, if we start out, if we were looking for a leak in a cup, we would fill the cup with water. We would not have the cup empty, because as soon as we fill the cup with water, boom, the water's coming out that little leak spot and we can see exactly where it is. Well, the spine is a load-bearing structure, and when we examine it, most commonly for these sorts of things, on an MRI, we are lying down, we do not have to strain on those tissues. And we've seen enough MRIs, or enough patients with MRIs of disc bulges and subsequent standing X-rays to know that perhaps there is justification and rationale to have a look at that disc bulge on a standing MRI. We don't say this to freak you out or anything like that. It's just to help you understand why we personally prefer this sort of imaging, because a standing up X-ray is very easy to do, very efficient, very affordable mechanism of getting a view into, especially in someone with a long-standing case of lower back pain. Understanding the way in which that spine load bears and weight bears is really, really important, because we've had patients come into clinic and they've said, oh, I tried this treatment for my disc bulge. I have an L4-5 disc bulge. It's not very good, and I didn't respond right. And we go, okay, well, let's have a look at you. And we stand you up, and all of a sudden, the vertebrae that were aligned, all of a sudden, you stand them up, and boom, it slides forwards. And now we know, okay, there's something going on there. Maybe it's degenerative. Maybe it is a degenerative one, and there weren't any pars defects. And make sure, if you're wondering what that is and you've got this condition, make sure you're following our page, because we've done a couple of videos on this particular topic, which will go into that in more detail. But then you stand them up and you see that it slides forwards. And now we know what we're dealing with. And then we can effectively communicate that to you, the patient, to help you understand what's going on there and what we can do about it going forwards. But also why perhaps some of those other treatments haven't quite got to the root cause, because we've been thinking it's this problem when actually it's that problem. So that is fundamentally why. Yes, MRIs are fantastic. You can see the disc, you can see the hydration, you can see some degeneration. You can see those pars defects we've talked about. And we can see a bunch of other things, as well as maybe some more nasty things that we very, very rarely see. But with a load-bearing image, we see so much more information, which is a tool to help us educate the patient, educate you about your own body. And from doing this thousands of times with patients, it really makes a massive difference. That's the big feedback that we get. It makes a massive difference when you not only just hold this piece of report and say, hey, you've got this, that's what's going on, but actually use that tool as a way of that person, you, understanding your own body better. And that makes all the difference to a prognosis, adherence to rehabilitation, and doing the right things going forwards.